from England. We're meant to have students from Ireland joining us. We're meant to have our students from America joining us, New York, to be specific. And we should have had students from the Caribbean, which is probably kind of on the same time zone. We're expecting from Trinidad to join. I have just texted their lecturer and asked, what's going on. But we want to give a kickoff at the start anyway. I think it's important we kind of introduce ourselves, because we've done this very much in a UK context, and normally everyone knows who Nicole, Shabby, and I are. So I'll start with my own self. I'm Calvin Morley. I'm a professor for diversity and social justice here at London South Bank University. And I'm a nurse by background, adult nursing, and my specialty is in intensive care. So, Nicole?
Thank you, Calvin. Hello, everyone. My name is Nicole McIntosh. I'm the Regional Head of Nursing and Midwifery at Health Education England. I'm also Honorary Visiting Professor at City University of London. It's always a pleasure to join these calls, so I really want you to feel safe to share and to learn and just interact with us. Thank you.
Okay. And Shabby, should we go to you next?
Hi everyone, I'm Shabby. I am the Program Director for Nursing Associate with a role in England for nursing. My background is nursing in intensive care. And as you can hear, I'm from France originally, and I moved in England a couple of years ago. I do some research in education, social media, and equity and diversity as well. So I'm very glad to be here tonight, because I think we're going to travel without even moving from our office, which is great. I really look forward here. Thank you everyone to be here.
Thank you. And we also have John, who is one of our educators. John, you can introduce yourself.
Hi, everybody. My name is John. My pronouns are he or they. I'm an assistant professor.
Dr. John Gilmore.
Dr. John Gilmore, yeah. I'm a professor, assistant professor in nursing at University College Dublin. It's nice to see you there, Orla. And my work is predominantly in areas of inclusion health, which is all about dismantling and challenging social exclusion and barriers to healthcare, and particularly interested in gender and sexual minority health as well. So it's lovely to be here. And I've worked clinically in critical care and now more predominantly in homelessness health and inclusion health.
Great, thank you. And so the way we wanted to do today is really and truly, thank you, Gabrielle, for joining us. Gabrielle's from Trinidad. Gabrielle, you can pop your camera on and say hello. Hello. Yeah, you're still muted, so.
Pleasant good afternoon to each and everyone. Sorry for joining late. I had a bit of technical issues. So my name is Gabrielle Kalinda, and I am a final year nursing student. Thank God. So I'm looking at graduating and doing my licensing exam in about roughly 2 to 3 months. So it's a pleasure to be with you guys today, and I'm here to learn. I'm here to just discuss and talk about the realities of nursing as a student. So I look forward to this forum. Great,
thank you. And just I guess some of the terminologies. So to our American and Trinidadian students who are joining, what really, when, as Gabrielle said, licensing, when we say registration, that's what we mean here in England. So if we say students are at a point of registration, it's what you call licensing, okay? So when we're talking, sometimes I may just interject to give you some of that. So I just wanted to kick it off, and also welcome to New York. We're going to wave to you because we know you're all in a group. Hello, how are you all? I'm not sure if you have one of your educators in the classroom with you. Have you got someone who wants to put their face on and say hello? Hello, but you're muted. Okay, we can't hear you. Nice to see you. So today, really and truly, is just to explain to everyone who's on the call, and to our UK students, welcome as well. We really value you every month that you come in and you participate. Hello, we got it. We got your hello. We run this forum. Did you want to say something?
We're a group here in New Jersey of pre-nursing students. They will graduate from secondary school next month. Most of them are already enrolled in colleges and universities in nursing classes. It was something that they started here at our school about 3 years ago as a readiness, and we partner with the community college across the street. I'm an assistant professor over there, mostly for clinical, and I work here full time in the high school, as we call it. And we always talk about registering and licensing in the NCLEX.
Okay. Thank you, and it's nice to get those terminology right, so everyone on the call knows we're kind of on the same boat. And I got in touch with you all through Patricia, because Patricia and I have met at several conferences, and you know, kept our contacts really. So it's great to see you all. So welcome, the future of New Jersey nursing. Wonderful, indeed, because you are going to be the future nurses. So thank you all. So this is just to explain, this is a safe space, and every month we have a theme discussion, and this month we wanted to look at it as international networking, and to join you all together as students and student nurses. And as you know, I don't know in other countries, but certainly here we have opportunities for what we call electives, where you can go to other countries and do a 6-week stint, and this may be a good opportunity for people to start, you know, networking. And you know, you could share your details if you like, you know, if you want to in the chat, if you want people to connect with you. And today we really wanted to talk about something that we've all experienced, which is the COVID pandemic. And we wanted to know how students, nurses experience that. So as I was saying earlier on, in the UK, our student nurses had various options. And some of those options were that they either stopped working completely and they suspended their program, and they sort of froze where they were, and because of the pandemic. And that may be for reasons because they didn't feel safe going into the unknown pandemic. They had underlying issues that were considered, you know, triggers as such for COVID. So they were at risk factors and they decided to stay away. And then there were some students who had the option that they can stop being a student, but they go in and they become part of the paid workforce. And some of those hours, as they work, contributed to their final amount of hours. So here in the UK, it's 50-50. We do, what is it? Someone remind me, is it 1,500 hours? 1,500 hours clinical and 1,500 hours theory. So although they were paid to be hands-on workers, that hours still counted, and they could have gone back retrospectively and got some of their competencies signed off to get their registration. So that's just a little brief overview. But what we really want to do is hand over to you all. We want you all to actually talk today. And I don't know who would like to start it, of what your experience was like in your country of working during this pandemic. Gabriel, I see you came on first. I'm not sure if you want to kick us off. And Gabriel, you're my fellow countrywoman, so I'm enjoying hearing the accent, okay?
Okay, not a problem. Usually I'm accustomed to being pushed out there, you know, at first, so it's okay. With respect to my experience, wow, I would start from the beginning of the pandemic. So at first, you know, a lot of people were skeptical as to the severity, the seriousness of this virus. And because of that skepticism, you found persons saying, oh, it wouldn't reach us. You know, we're a tiny island, you know, all the way in the Caribbean Sea. It's not going to get to us. And even if we do, we can mitigate it. We could, you know, it'll be okay. So I feel as though our government put things in place, but the members of the nation were like, okay, we don't really need to take this serious. And then all of a sudden you started to get 1 case, and then 2 cases, and then the numbers started to increase. So now you have persons thinking, oh God, it's here. How do we really deal with this? But more from a student's perspective, we're thinking, okay, what's going to happen with us? Is school going to close? And the anxiety starts coming up, you know, and that's exactly what took place. The borders were closed, and shortly after that, they closed schools from primary schools all the way up to college, you know, up to university. And some persons felt comfortable knowing that, okay, we're now resorting to an online platform because I will be safe in my home, while others felt as though I'm doing a nursing degree. This is not me doing accounts. And I make that example to say, this is not a degree. I could just sit down in front of my laptop, open a book, and study for. This is something, this is a profession. This is something I need to put my hands to. I need to practice. And that was our biggest challenge. Our biggest challenge was the fact that we're not out there. So because schools closed, the ministry also pulled us off from our clinical setting. So we were no longer in the hospitals. So we literally were unable to practice. I mean, the school, they tried their best to try to facilitate us. You know, we had our instructors try to teach us things online, but it's only so much that we could have done, really and truly. So you had students feeling as though I'm not prepared. I feel as though I'm not really a nurse. I feel as though I'm not even a nursing student because I could only do so much, you know. And to make matters worse, you have the fact that not only are schools closed, but the country is shut down. So now you have to take into consideration, persons are already worrying based on their academic and their professional practice. And now you have persons who are at home, those who may be suffering from anxiety, those who are known to be the social butterfly of their groups, being now just combated. They're just in their home all day, every day, and it takes a toll on their mental health. And I am the school rep, so there would be times where students would contact me saying that, you know, I can't focus. I can't focus. I'm at home. Some persons' home situation isn't as good as others. You know, some persons have families. Some persons, when you escape, and this is the reality, when you leave home, even if it's to go to school, it's just an escape from your home environment. So now that you're bombarded, now that you are at home, there is no escape. You can't go to school. You can't go to the mall. You can't go and watch a movie because you have no access to these things. So we had students in terms of mental health seriously declining. And what we had to do was try to put them on to professional help that the university provides. But then there are students that don't want to seek that assistance. You know, they don't want to speak to a stranger, somebody who they do not know. They feel as though, you know, that person really can't help them. So there were situations where other students would have, and it's sad to say, but students would have resorted to things like alcohol. So you had an increase in alcohol abuse. You had an increase in non-prescription medication. You know, some students' sleeping schedules went out the window. Basically, you had students who had issues with sleeping, who were oversleeping. So now they tend to turn to these sleeping medication. So our experience, I'm not going to say it was totally negative, because on the flip side, now you have students networking more. You have students where necessarily they may not be as open face to face, but online they're a little more comfortable. So you see them tending to, and we have these online, these kind of refreshers. So we do refreshers. We provide students with opportunities where we could study online with one another. You know, we have games night. We utilize the online platforms as much as possible to try to say, hey, we're all going through this together, and we know it's challenging, you know, but at the same time, let's try to make the most of it as much as possible. I think this opportunity provided everyone with a level of camaraderie. You know, it allowed persons to really meet others, not only within our school, but even outside, because, and which is a good thing, because with respect to my university, we have, in the Faculty of Medical Sciences, we have 7 schools. And these 7 schools, although it's under one faculty, under one umbrella, you had kind of like an isolation factor. So the nurses stick to each other, the optometry students stick to each other, the medical students stick with, and you didn't have that integration. And because of this pandemic, actually, we were able to integrate our students, right? Both with respect to curriculum as well as just leisure activities. And we are happy to say that that level of camaraderie, when we get out to the clinical settings, you're seeing it now. You're seeing the nursing students really speaking to the medical students, and you're actually seeing them collaborating. And this is something that we weren't seeing before, because the medical students would come in with their head high, not speak to the nursing students. They would have an attitude. So there's pros and there are cons. But that was roughly our experience thus far. And now coming, I won't say to the end of the pandemic, because I tell people we have to get accustomed to this new norm, because it's going to be around for a while, you know, even futuristically. So now where we are at, especially myself and my classmates as final year students, when it is that we were able now to return to the wards, there was a state of us feeling uncomfortable, because we've been out of it for 2 years. And now you have us returning to this setting, and it's as though we're a fish out of water. We have to acclimatize quickly. Exams are coming up, we're stressed. And we have to do it in a time fashion where it needs to be quick, you know. So we had to really come together. You know, there are students who saying, if it wasn't for each other, not taking away what faculty has added or tried to assist us with, but really, if it wasn't for each other, we don't think that we'd have made it at least this far. Because when you're out on that ward, your instructor is not with you, you know, and then you have these senior nurses who, they don't necessarily want to hear the fact that you've been away for 2 years. They don't want to know. They want to know that you are competent enough to deal with a patient, because these are category 3 patients. These are patients that are in critical care and need your full attention. You need to be the best at what you do. So when you're put out there in that situation, you know, the fear arises, but what we're doing is we're learning to cope with it. And we just remember, listen, we can do this. We can do this. And the more we practice, the better we get. The more we practice, the better we get, you know. And that's where we're at right now. It's crunch time, but we're getting there. And the thing is, when you hear senior nurses critique you, but they also applaud you, then it boosts your confidence, you know, and then your morale and everything is better. Then you're in a better headspace, and you tell yourself, okay, I was hit with major stumbling blocks, you know, but we're getting there. But, you know, when you hear a patient really applaud you, they thank you. I didn't get this type of treatment before. You seem to know what you're doing. Are you a nurse? And then you laugh and you say, no, I'm just a student. You know, but just that simple interaction really makes the difference. So I don't want to go on because I could mumble for a while. So that's been our experience thus far in a nutshell.
So Gabrielle, and I'm sure other people want to come in and ask you some questions as well, but did you all not go out to work at all as students during the waves, you know, the initial waves of the pandemic?
Not the initial, no. We were pulled off, and it wasn't because of the university, it was because of the government. I think they felt as though, you know, at that critical time, they wanted the professionals. They didn't want students to try to get in their way, and you have students trying to shadow these persons, because these persons don't have time to really look at us, teach us, and so forth. I think they also, in terms of legalities, you know, there were legal implications of having us out there in that setting. Insurance didn't cover us for these things, so they pulled us off from the clinical setting. However, we returned last year while the pandemic was still going on, because obviously, because of time, they would have realized, okay, we could put certain things in place, but we needed them because now you have the burnout taking place within these professionals, you know, and they realize that these students are going to be out in the field regardless. This is what they're training for. So why not really bring them to not only have them continue their program, but also to aid with the current professionals in the hospital setting. So we were able to return. And myself, okay, so I currently work on a cardiology ward, right? But so it's not solely for COVID patients. However, I have come in contact with COVID patients. But because of my training, you know, what the school was doing, I was able to continue providing care for these COVID patients. You just need to know okay, this is the situation. I know what I have to do from what I shouldn't do. And you just continue doing what you've been doing for the past year. And that's the reality of it. I'm a nurse and I'm there to provide care, regardless of what the patient may be enduring.
Yeah, I like that. I'm going to open it up for discussions. So thank you for kicking that off, Gabrielle. I saw Dr. Ocho just joined us, who is the head of the UE School of Nursing. Oscar, it's evening here by me, but I know it's lunchtime by you. Good day. How are you? I'm not sure if Oscar can hear me, but I know I just admitted him into the room.
Yes, Calvin, I'm hearing you and I'm seeing Gabrielle and the others, so this is good.
Yeah. We were
Sorry
just
about that. I didn't get the link.
okay. But thank you for joining us. And we were just talking about how different it was in Trinidad, probably to some of what we were doing here in the UK. Of course, our students had the option to go into practice or either, as we call it, shield or halt their program for a while. So it's good to hear how. Are you all back on campus now, or are you all still online?
No, we are still online. Hi, Shabby. It's good to see you.
Hi, Oscar. Good to see you too.
Yes, we are still online. They are still looking at us coming back out in full in September. Okay. But our numbers have started to go up again, so we don't know how that will affect us. But our clinicals, we continue clinicals, and the students will still be getting their clinical lab skills done.
So I'm going to move over across to Dr. John Gilmore and probably one or two of his students who are here. John, what was that experience in Ireland like?
Yeah, I see Orla's online, so I don't know. She might want to share some perspectives, because I think if it's the Orla, I think it is. She's an intern. Yeah, it is. Orla.
Hi. How are you?
Or you're a mental health nursing student, aren't you?
I am indeed. So I'm fourth year mental health nursing student. And when the pandemic started, I would have been in second year and I would have been actually on clinical placement. So when the pandemic started to get a bit more severe and concerning in Ireland, we as well were pulled from clinical placement just for kind of safety precautions and everything else. But you did have the option to work as a healthcare assistant. I'm not sure if there's different terminology for that in other countries, but that's basically like to assist with personal care in the healthcare facility. So I chose to do that. So I was working as a healthcare assistant for a little bit of time, and some of those hours then counted again towards clinical placement. But I found one of the things that I found quite challenging in the facility that I was working, we did have a COVID outbreak. So my big concern was kind of bringing the virus home to my family. So I found that kind of challenging because I was trying to then isolate from my family as well. But the concern was still there because at that time, that's nearly 2 years ago now, and we kind of didn't understand or didn't kind of know how it was going to be and what the severity of it was. So I found that quite challenging. Maybe as well then, like I'm in mental health nursing, so a big part of the mental health nurse's role would be providing one-to-one support to the patient. And I was really concerned of how that would go with the PPE, having a mask on, hiding your face when you're trying to have that, that very meaningful interaction with the patients. That was another thing. Now, I think it's kind of one of those things where we've all adjusted to it now, and I think patients as well have adjusted to it. But at the start, I was very concerned about that, like how that meaningful interaction would go when you have a mask on and when you had full PPE. And then another thing that was very upsetting to see was I was working in a nursing home at that time, and patients couldn't actually see their families. So at the time when there was the outbreak, there was no visits at all. So that was very challenging. And it was just really important, like for everyone to kind of take the responsibility to facilitate video calls, facilitate phone calls, particularly for patients who maybe had difficulty speaking, just that they had the video call and that means of communication was there with their family. That was really important as well.
Great. Thank you, Ola, for that. And I think some of the things we don't often think about which you raise, particularly in your specialism in mental health. You want to see people, you want them to see your facial expression, and you were just totally shielded, or they were shielded from you. They couldn't see that. And that's important. So thank you. Patrick, I see your camera is on. You want to tell us about your experience? Hello.
Yeah, hi everyone. I recognize Dr. John there. He's one of my lecturers in UCD Ireland. Well, for me, or for most of us, I say the pandemic, well, I don't want to sound a bit weird or strange, but as a student nurse, the pandemic is kind of a great opportunity as a student nurse for us, for me, and for most of my set. Like, we were able to see so many things that maybe it will take us 10, 15, or 20 years of our career to be exposed to so many of those clinical experiences. Because as Ola said, at the beginning of pandemic, we were being given option to not to go to a nursing home or anywhere that we can continue with our placement. But when it comes to January 2021, the government said they need everybody back because they were struggling with staffing level. So because of the staffing level, and they said, okay, they don't want the first year student or stage 1 student on placement, but they want stage 2, stage 3, and internship. Well, they mostly rely on the internship student, which is the 4th year student in Ireland. So because of that, we were being recalled back to placement, and it was for me an eye-opener, a great learning opportunity, more than what you'll be able or be allowed to do if you are on normal placement, because then you are being exposed. Don't let me use the word allow. You are being exposed to a lot of clinical experiences. So we really, really enjoy it, because my first placement back then was the emergency department, my ED placement, and it was really, really hands-on. Like many of my stage mates, like the cohort of us, we were able to even be involved with CPR, like, because I was in resource. So resource was very, very busy, and you have your full PPE from the time you step your foot into the AD department. The only time that you can only doff your PPE is when you are going for your break. Apart from that, 12-hour or 12.5-hour shift, you have full PPE from head to toe, 11 hours on, and you'll be perspirating and everything. But I love it, and every one of us enjoy it. I'm so sorry for other students like Gabriel that they were not able to be able to go on the clinical placement. I would say they probably miss a lot. But look, there's still more learning opportunity out there. Irish government were very good, though it takes a lot of negotiation from the colleges, from union, from INMO here, that is Irish Nurses Midwife Organization. They were very good. They get involved, and even the politicians, the opposition as well, they get involved to make sure that students are well looked after. And the colleges, like UCD as well, we have a daily like check-in, that to make sure that are you okay? Do you have any symptoms? Just to make sure that you check in. If you are not okay, if something is not right, if you have any of the COVID symptoms, you don't have to go. It's not like, oh, you must go. It's not like you must go. If you're not feeling well, you have been exempted, but you will pay back, because as we all know, it's EU directive that we have to complete a particular hour of the placement before we can register. So it was really, really good. So thank you to all our lecturers and everyone involved in Ireland.
That's really great, Patrick. Thank you for that. I see Victor's turned his camera on. Victor was one of my students, and we still haven't met in person. I've taught him online, and when I'm on campus, he's not there. Hello, Victor.
Good afternoon, everyone. Hello, Kevin. Hello, Catalan. How are you, everybody? Good to see us today. During the pandemic, we just entered school. We're just in year 1, as Patrick said, and we have just done our first I think, first semester exams, and we're waiting to start kick. To be frank, when some of the students have not even met, as Kevin said, we heard the name Kevin. I think we met once or twice briefly, because it's always busy as a prof, So as a whole, we didn't expect it. As Gabriela said initially, it will end. It's not going to spread too far. But knowingly, one day we heard the breaking news. It was in England, and before we knew it, it was all over, and the school had to shut down. That was it. And before then, the school was making us, giving us information, letting us knowing that anything might happen, be ready for the worst. But understandably, provision was provided. A lot of us, I would say, going to school in our age, we are not used to internet education, you know what I mean? Online was a challenge, but thank God that, as I said, we learned so many things, and we broke through the cohort. For the 3 years, we were able to do a lot. I think we were the one that was really affected, because at that time, we have just done just one placement, preparing for the second one, and that was it. So we couldn't do nothing. As Kevin said, we're not allowed to work in the clinical area because we're not protected, and again, because we are just low in skill. Let me use that word. We have not had that experience. But personally, because I was prior to my uni studies, I was already working as an NCA in one of the trusts in London. So, and I was working in ITU. It was very, very severe. Every day, those who came to meet will not go back. No, in the morning, I was doing night shift. You come around in the morning, in the evening, they're not there again. But academically, we are threatening. While I was working there, the first week, the last day of March 2021, I got caught in it, and I was off work for 6 months. I didn't come back. I think Gary was aware anyway. I reported to Gary, one of my lecturer. He was my personal tutor then. I don't think Kevin was around. I took it home. The whole of my family, we got it. And in there, I had an exam, communication exam, which I have to write. I couldn't have just left it. I emailed my tutor. He said, Victor, you can't write, you can leave it. Like quite a lot of people. So as a cohort leader, I was getting a lot of emails, messages, what are we going to do? It was really, really bad at that time. Even me myself, a lot of people didn't know I was having it. But thank God we were able to skate through. But the bottom line of the whole issue was that the school prepared us while we were there. A lot of things we could have done online, then we were able to do them. Clinical placement. We did 1 or 2 online, like the mother and newborn baby. We did that online, and some other things. For me, I think it was very, very encouraging and empowering too. Like for me now, I'm very good in my online learning. Can do a lot of things. Thank God for the COVID, because prior to that, I didn't have that idea of doing such online. The family too, everybody had a laptop on the kids were able to begin to do things on their own, get busy, and everybody have time opportunity to do their own thing themselves. It's an opportunity, a privilege for us to really look inward. Again, the bonding that was not there as a family, we begin to articulate them again. Everybody was at home, kids were with daddy, we can see mommy 24 hours a day, and these ideas, the kids began to bake cakes, then the boy become so, innovative. What can I do? Craft work was coming in, because I got 4 kids with my education, and also I was also working, and they're still very young. So, and everybody was doing things. My daughter went into athletics. Now today, she's one of the best. She's the best in her form because of COVID, because she was practicing every day. That we can't stay home. We go for a walk in the morning, we go in the evening. But academically, again, a lot of people was affected psychologically, because as I said, there was a lot of mental health issues that came up, because I was working in ITU, and sometimes I go to ED, can see the outflow of patients. But as a student, the impact it has on us is that we were the one that was most affected. We didn't really have to enjoy our lecturers like Kevin, but still, there was a lot of provisions that was provided for us to cover that area. But today, I'm on my management placement. I've gotten a job in ITU, and I can't wait to start my nursing career. So it's been interesting. I've done respiratory ward at that time. I've done ITU, and I've done, a lot of things. The nursing career has opened for me, especially the COVID. I learned so much experiences. Things I could have learned without the COVID, because while I was working as an NCA, I worked with different multidisciplinaries, the doctors, the physios, everybody, So they were all there, and I was there with them too. It's a time where everybody was involved. Everybody was recognized. Every input was needed. So I learned so much as a nurse. The matron, was able to even accredit Victor. We can't wait to see you. Get ready, get finished. With all this you have in your tips, you can succeed in ITU. But thank God today, I've gone for interview. I'm waiting to start my job in September. Thank you.
That's so good to hear that you secured a job. And I know you had your OSCE on Monday because I was examining students on Monday.
I've done my on Monday and I'm done. I was looking forward to that. I'm done. I'm a free man. Submitted my assignments, done my OSCE, just waiting for the placement, 5 weeks remaining. I'm going for holiday after 4 years.
So thank you. I just wanted to ask our colleagues in New York, is there anything you'd like to share? I know you're pre-licensed students as such, but what was your experience of COVID, even while studying? Does anybody want to share anything?
What do you want to share? Okay. I think they got out of the habit of sharing with not being online. I know one of the worst things we hit personally was all of our supplies were taken very early in the pandemic. I was contacted at home, asked where are the masks, where are the gowns, where is this, where is that, and they were removed from the school. So by the time we really got up to online, we really were struggling even to teach, even to send PPE home with the kids to kind of demo it online. So we had a few people using bathrobes to simulate. They got very creative. They used dishwashing gloves because they didn't have enough rubber gloves in their house. They made their own masks when it was time to put on masks. So, and then they recorded it, and we spent some time watching their technique. Clinical still isn't up and running for these guys. The high school students are way low on that ladder to be allowed into the facilities, although I go Wednesday, Thursday, and Friday morning to observational experiences with health occupation students. They allow them to explore all health occupations. And we've been back in same-day surgery and back in endoscopy, so that's been really good. These guys kind of didn't get that opportunity because they're often used at the bedside, bathing, positioning, kind of like that first level of learning. So they've been here in the lab. What did you like about the work about school during the pandemic? Go ahead. Nothing. You were sent home with meds, needles, a stethoscope. How was it delivered? And across in the other classrooms, we were kind of handing plastic bags out of the window because no one was allowed in the school, or putting pickup tables out front with names on them, including their textbooks.
So that what's really interesting is I think I hope and John and Shabby could correct me. We certainly weren't doing that in the UK and Ireland. We weren't actually giving students stuff to do. Did you all do that, John?
So not necessarily the nursing element, but my colleagues in midwifery actually have really started to they've just written up a paper of where perineal suturing, they handed out kits to the students to practice at home, because obviously traditionally we bring them into a big simulation lab and assess them there, but we couldn't bring 30 students in, so they would do a lot of their practice at home with their kits, and then they'd come in for the OSCE for a one-to-one. So yeah, we did a little bit, and listening to Orla Patrick, because one of the things in Ireland that the pandemic did was brought a real focus onto nursing students and nursing interns. So unlike in the UK, and I'm not sure about, and not in the States, but other countries, so our program, they do three 3.5 years essentially of theory, and then they have a 9-month internship at the end. And interns are like Orla at the minute are a little bit different because they're paid members of staff in the hospitals. They maintain their student kind of protections in some areas, but they're actually members of employees. So when Patrick and colleagues were sent home initially, and Orla, when she was a second-year student, sent home, actually the interns weren't allowed. Even though they were students, they were frontline workers. And since the focus of the pandemic, there was a big call around payment of student nurses. So student nurses still aren't being paid in Ireland, but the allowances that they can access have improved. But our 4th-year interns had faced actually pay cuts systemically the last few years, and now a lot of that has been restored. So I think people have appreciated the role of nursing students, and that they're not just like other students. They are really hands-on from the beginnings. That was definitely a positive. That we've been. I suppose we could argue that nursing in general has had more focus, but I think the students in Ireland at least have capitalised a bit on that and done well to highlight their important role in the health service.
That's really good to know. Just to say, Dr. Ocho, I'm going to bring you in a second. I see your hand is up. I did OSCEs during the pandemic, just like what Victor, went through recently, and most students do. And the student, obviously, she was doing it at home, and she took her daughter's doll, and she just went through everything on this little doll in her hand, And our students were being really innovative. That's what I'm trying to say. Students were really innovative of how they learn. So when you talk in New Jersey about your students using their rubber gloves at home and their dressing gowns, we saw how the pandemic really made us innovative in the way we learn. Dr. Ocho, over to you.
Yes, thanks so much, Calvin. It's so rich to hear the experiences that faculty across the globe had to engage with, and maybe Gabrielle can speak a little more. But we were in a particularly challenging position because the Ministry of Health closed all the clinical sites to students. Medical students, dental students, vet students. No, so in order for students to get back to the clinical area, we had to get permission from the Ministry of Health for students to access the clinical sites. So how were we to ensure that the students still got opportunities to practice their skills, because the university was closed, but the teaching continued online? So we in some instances, we packaged some things like syringes, needles, and some dressing gauze and so on, and we gave each student, so depending on where they were in their academic development, they had to now go and practice on their relatives, or practice using other things. So you found that we had to depend on students doing a lot of videos as assessment to ensure that the dexterity as it relates to the clinical competence could still be measured to some level. Now, it was very onerous on the part of the faculty, but I think that also gives students the opportunity to maintain some level of practice. The other challenge we had is that they were minimizing the number of students who were placed in the clinical area. So we now had to place students on shifts. So they went from 7 to 12, and then from 1 to 5, because they still had not only the university requirements, but our nursing council requires 3,200 hours of clinical over the 4-year period. So we still had to find ways of getting the students involved in the online environment, and Gabby's group was smack into this from year 2, really. So that was an interesting learning curve for us with its inherent challenges. Just wanted to share so that we'll see the commonality in our experiences.
Okay, thank you for that, Oscar. Thank you so much. Flora May, I want to bring you in a second. I hope you will be able to turn your camera on and join us. But Nicole, Oscar, you weren't here for the introduction. Nicole McIntosh is the head of regional nursing for London through Health Education England. Nicole, I was wondering if, we're hearing all of this stuff, and I'm thinking from you at the HEE there at this time of the pandemic, what was happening in that, that period, because we know we were turning curriculums around overnight. And I was just wondering for you all at HEE, what was happening,
Yes,
students necessarily don't understand what, you were doing, or even sometimes us as academics had to do. So I just wonder if you want to share a little bit of that.
Thank you. Thank you very much. I've been listening intently and taking notes, and I really like that social butterfly of the group analogy that Gabrielle mentioned. So I've made a note of that, Gabrielle. I'm going to do some research because I can relate. I think for us at HE, Health Education England, we were conveners. So we were getting stakeholders together really quickly. So overnight, we were told everything's going to be closed, student education is going to be paused, but then looking at first years, making that virtual. So my role, I started in November 2020, so I missed the first wave. I came in when we had exhausted staff in my department, and we were getting ready for the Omicron. I think it was Delta or Omicron in the UK. We had to really work well with our regulators, nursing and midwifery council, looking at even the role of the practice assessors and the practice supervisors, and getting agreement to have it as being one person could do the job, because we had staff going off with COVID and isolating. Students played a massive role. We could not have dealt with the pandemic the way we had without the support of our students on what we called extended clinical placements that Calvin mentioned. So it was an opt-in. So you could opt into that and it would count to your hours. But I think, Calvin, what it did, as was it Patrick said, the opportunities of COVID. I'm an optimist as well, Patrick, and we looked at it, things that would have taken years. Yeah, people who are at opposing ends of the table, like Putin and his advisors at very large, the opposite end of the table, quickly got together, got rid of red tape, and things happened. So we adopted this Nike, just do it kind of thing. Let us make sure that it's safe. But we got through, and we overcame a lot of hurdles that we now need to make sure that while we learn the lessons of COVID, that we don't lose some of that collaboration. Yeah, doing things quick, quality improvement, PDSAs. In terms of what I'm hearing from students though, Calvin, and that catching up and feeling that you're not, when mentors say, I would expect you to know this in your third year. We are working actively with our mentors to stop that, because that is quite judgmental, and students need to be in a psychologically safe space where you're able to say, actually, yes, I'm in my third year, but I've not seen this before and I need someone to help me. So we need to have our preceptorship programs are being reviewed. So preceptorship is that period of transition after you get your registration. So after you take off your L plates, your learner plates, and you put on the P plates, just passed your test, that's the preceptorship period. Now, I am a dinosaur. I might not look it, but I'm a dinosaur in nursing. I never had preceptorship, yeah? So when I hear about preceptorship and beyond, it fills my heart with joy, because that means we're taking it very seriously. That period of transition, it's a big deal. So you won't be like me, being afraid, as I said to Calvin, to answer the telephone when you're newly qualified. You will be more confident. And that is where we need students to really be involved in how we design these preceptorships. So we're hearing what you're saying. I'm looking at the chat, and that thing about catching up. I like, Gabrielle, you mentioned some refresher sessions. Bite size is good. I have a son who's doing GCSE, and I know that attention spans during the pandemic has gone down. So bite size is quite good, but at HE, we're actively advocating for change and for learning and for hearing, and to be kinder to each other as we recover, because morale is quite low, Calvin. As you know, we're struggling to retain. So in the UK, we're quite worried, if I'm honest, about people who are close to retirement thinking, yeah, I stuck around for COVID, but I'm off. We want to keep those people. But also, we're quite worried about the trend where newly qualified staff within a very short period are getting disillusioned and leaving, and that needs to be addressed. I'm talking very short. I won't give you the figure because it might be too shocking to hear on a Thursday afternoon. But yes, it's worrying. So what we're saying to staff who say to us, HE, what are you doing to train more? We're saying, what are you doing to keep them? So are you being kind? Yes. Are you being a compassionate leader? Are you ensuring that our student leaders, who was it? Is it Victor, who's a cohort leader? And you mentioned, and Gabriel mentioned about the toll it takes when you are contacted in a pandemic, when you are barely coping as well, and people are telling you these issues. Are we looking after our future leaders? So there's a lot to take from what we're hearing, but I'm quite positive. So I think we need to look at it. At least we have a glass. Yes, whether it's half empty, half full, but we have a glass. We've been through what Patrick said it would take maybe 10, 15 years, Patrick. Your strengths of being resilient, of being agile, of going on the ward and knowing anything can happen. We weren't exposed to that. So you'll go in your career with a different mental attitude. It's like, oh yeah, a pandemic, yeah, bring it on. We hear about monkeypox. Is that what the term is it? You know, that new term? I'm watching that closely. You hear about this new thing with students and the respiratory illnesses and the hepatitis. We are ready, so we are more resilient. But resilient, as I said before I close, resilient is not going until you break. It's knowing when you need a break. So don't let anyone tell you that because you're not breaking, you're not being resilient. The emotional intelligence to know, you know what, I'm stressed. I need to speak to someone. That is what resilience is for me anyway. That's how I cope.
Great, thank you so much, Nicole. Flora May, I hope I got your first name. Do you want to come on and tell us a little bit? I think you're in Cali State, you said. Flora May, are you still online? Hello,
Hi.
thank you for joining us.
Yes, I am just finished my junior year with my PEDS ATI final. And yeah, I study at CSUB, and we are moving on to the summer now. We've all finished, basically. Yes.
Did you have to experience working during the pandemic? I mean, we're still in a pandemic, so what's that like for you at the moment? It's nice for us to get the American flavor.
Yes. So I started the nursing program all Zoom. So basically, I'm a Zoom nurse, Zoom student nurse.
That's a nice term. I've never heard that term before.
Yeah. So since we started, the program has actually been very great at managing clinical placements, clinical rotations, even during the pandemic. Although we did have experienced like some issues where we couldn't go into the patient's room if they are COVID positive, obviously, or if like going to different floors, like it'd be closed off to us nursing students. And I felt like that kind of blocking or the obstacle of that was extremely, how do you say this? Like, it brought a lot of morale down. I felt like we should have been exposed to it even early on because it would be a new norm. That's where I kind of felt during the first few years. And now in my senior year, we're all going back in person. Everything is going back, but it's still quite like nerve-wracking to know that I'm gonna be going back after nearly more than half of my student nursing career. So yes. Yeah.
Okay. Thank you for that. I guess that's the anxiety. As you say, we're still in a state, we're not sure. But as Nicole pointed out, you know, people like Patrick and Victor and Orla and you go back on a ward and they say, oh, this ward is now a COVID ward. You know exactly how to flip it and work, you know, because that's been part of your experience, which is great. Oluwola, I see you're online and you've been talking a lot about, you know, how COVID was exhausting. I don't know if you want to come in and say anything. But so I'm going to put that offer out to you, Olawole Eden. But John has got his hand up, not John, but John. John, do you want to speak? Hello. We can see your camera is trying to load.
Maybe he's on mute, Calvin. I'm not sure. Oh no, he's not.
No, he's not muted. John, are you there? Okay, so while John is trying to do that, I'm going to ask Olawole, did you want to say anything at all? I mean, you don't have to put your camera on, but you've been certainly, typing some stuff, and I was wondering if you wanted to share, what that's been like.
I suppose maybe just some things that, sorry, was it me you were calling on there?
Anybody can talk, I don't mind now.
I suppose maybe just some things like to learn from the pandemic. Sorry.
We can hear you. Oh, now you've muted yourself.
The Wi-Fi might be playing off, Calvin.
Yeah.
Sorry, I think my internet connection just went a little bit funny there. So I suppose maybe some things like that I've learned from the pandemic is the importance of communication between patients and families. That's definitely been a big learning experience, just of how much it can affect patients when they don't hear from their families, or not when they don't hear from their families, but when they can't communicate with their families. And I suppose as a student nurse and as a healthcare assistant previously, just your role in supporting patients and how that can make you feel very good as well when you do have that opportunity to support that communication between patients and their families. So that was definitely something that I've learned.
Okay, thank you. Gabrielle, is there? Oh, hi, John, you're there. Hello, John. But I think you're muted. We can't hear you yet. You're still muted, and we've lost you. Okay, John, we know you're trying to get on. Here we go. We still can't hear you.
Do you have any headphones? Do you have any headphones you can connect to your laptop or your phone? That must work.
One of the downsides, Calvin, is the Wi-Fi, isn't it?
Exactly.
Yeah.
So, Olawole, I see you're back. I was asking Olu if you wanted to share anything from what you were saying in the chat. No pressure, as you know, it's a safe space.
Yeah, so sorry, my network just switched off, so I just had to log out and reconnect. Sorry, my camera is not on.
Okay.
Yeah, actually, it's a good forum, and being on placement, choosing to study nursing at this particular point in time is actually the best choice I've actually made in my entire lifetime, because it's actually coming into the workforce when it is the hottest. You have all the opportunities to learn. We actually came in, I'm from Nigeria, I came into the UK in 2020 to study adult nursing. And at that point in time, when we came in, the university didn't know we were going to come because it was the middle of the pandemic. So when we came into the country, we were just trying to settle down. It's going to be an online class for the meantime. I'm from the University of Hertfordshire. The good thing about University of Hertfordshire is that we got all the support. It was as if we had a one-to-one from every lecturer. So we had that support. But leaving my family at home in Nigeria and coming over and coming to study online, you have not met your lecturers, you've not met your fellow students, and everything was just, the pressure was on you. You are not going, you can't go out. It's the restriction was fully in place. But going to placement was actually the best opportunity for learning, because the way I learned putting my hands on it. And during the COVID, it was a mixture of many things. The whole of England, they were short-staffed. So you were doing the work of an ACA, you were doing the work of a student. Nurses are short-staffed, so they don't have enough time. So you need to pick up those skills yourself. And the good part of it was that no ward was left out of it. I was on an oncology ward, but every ward is either one bay is shut down, cleaned, Before that one is every other one who is contact, they move them to another ward. Before you know, everything is back to COVID. So everything we had to learn was experience. Nobody is telling you to wash your hands. Nobody is telling you to put on the PPEs. You have to. It was, as a matter of fact, till date, if I'm going out of the house, my PPEs are on, my face mask is on, even though it has been lifted in England, because it became part of the whole system. And it's actually, apart from the fact that it made us resilient, we are able to learn in a very fast way. There's so many students that fell ill, but the good part of it is that as you are coming down with the COVID, the school is providing support, the hospital is providing support. And as a matter of fact, one of those decisions that the Health Education England did was not to pull out students during the pandemic. I know there was many memos I saw during that period. Should we pull out students? Some students complained, should we put them out? But the fact that we were in the workforce, it gave us the opportunity to learn. And I can assure you how we are rounding up. We have already rounded up second year. It's just going to the third year. It's just as if I just came out from a 10 weeks placement, and staff on the ward are always telling us, you guys are ready. Just go finish your third year and come and join us. Because we've been able to learn those skills. We are able to manage patients ourselves. During this last 10 weeks placement, when I get to ward, I tell my mentor, how many of this ward are my patients? I'm able to do my notes. When it's time for medication, I will write it out. She'll look at it. Okay, good. And we'll do it together. Go administer it together. And with that, you are being trained. It's just like you are being trained to do many things at the same time. You can multitask. And one of those things that I need to bring out is that it was emotionally draining during that period. I was coming from Luton to Barnet, like 2 hours on the train. You are getting to hospital from that 7:30 to 8 p.m. at night. You are doing, sometimes we don't even go for a break because there are so many things to do. And by the time you are going home, you are thinking of your patients that you, after laboring, after trying to make sure they are well, they are deteriorating. And by the time you get home, that is all you have on your mind. Before you know what's happening, it's the next day. So all those things are all cumulated to build. I can assure you that the nurses that have been built in these last 2 years might be the solution for the coming generation. I think I need to stop there.
Thank you so much for sharing that, Olu. And to actually arrive in the UK as a student, during a pandemic, that is really, really applaudable as such. John, I want to give you another opportunity if you want to, if your IT is working. So John, I don't know if you want to try and talk or see if you can come in line. Something's happening. We can see you. We can't hear you. We wanted to give you the opportunity. Probably you could type in the chat and at least we will get some of, a synopsis of what you were saying. I'm really conscious of time, and we like to end our forum. And just to say to you all, we are planning to have a conference in the summer. Nicole Shabby and I are planning that, and I have to tap one of Nicole's bosses to see if we get how we get the funding to at least pay for students, travel and treat you all nice on the day as such. So Gabrielle, I wonder if there's anything else you wanted to share with us from that Caribbean perspective you and your peers have been experiencing or experience. As we begin to round up our session, we're going to end soon.
So what myself and a few of my classmates would have experienced was there was a collaboratory initiative between ourselves at UE as well as the students of Columbia University, right? And we were really focused on maternal health, right? And although again, because of the pandemic, our borders were closed, we couldn't really have those students come to Trinidad or even us go across to the US. It was still a good initiative in that we were able to not only network really, but we were able to share our experiences and our approach to health when it comes to maternal health and so forth, you know. And it was good. We, the Trinidadian students, felt extremely happy because when you have these students from the US, you know, which is noted as a first world country, you know, and just us, a tiny island, you know, applaud us for our practices, you know, and the initiatives that we not only our health sector, but us as students take to try to curb, you know, infant mortality and these different things. When you hear them applaud us, it really makes you feel as though, okay, I'm just a dot on the world map, but we're making a difference, you know. And that really brings about such satisfaction, a certain level of pride. It makes you feel as though we are not what people think in terms of, oh, a third world status, you know. It's good to know that our nursing, we have recognition globally in terms of nursing within the Caribbean. It's good to know that a lot of our Caribbean nurses actually are being recognized, and we're having our journal articles publicized and so forth. Even students, you know, as I said, I'm a final year student, and we are actually now wrapping up our research project. And what we primarily looked at was the effects that this COVID-19 pandemic had on nursing students, especially those that are preparing to really go out into the profession itself, you know. And based on our findings, when we presented our project, our lecturer, our professor was pleased to the point where she said, you know, we need to do something about this to have this publicized. Because when you hear the experiences of students, as I made mention earlier on, it's not just that of academics, you know, it's not just, okay, it's affecting my academics, it's really affecting my mental health, you know. And I told persons before, mental health was a taboo, quote unquote, a taboo topic years before, but the last 5 years, it's really the highlight of discussion, you know. And I think this pandemic highlighted it even more. This pandemic put a spotlight on nursing, especially as a degree, as a profession, because I think persons didn't recognize how difficult this degree is, you know. And now I'm hearing people saying, oh my God, nursing is one of the hardest degrees, you know. I'm hearing medical students saying, Gabby, I didn't realize that you'll really get into things like this. I didn't know that you'll really dissect the pathophys aspect of this. And I'm saying, yeah, we nurses, you know. We probably know more than y'all with respect to certain things. So keeping that in mind, you know, our experience, it was difficult. I do not want to do this again. I will not wish that this happens or other students have to deal with this again, because just to adapt, it's trial and error. You know, okay, let's try this. This doesn't work. Okay, let's try this. You know, and you still have to maintain your family life. You still have to maintain your grades, you know, and it's a difficult journey. But I believe, and I laugh and I tell my lecturers, I say, if we could do this, then I don't think that we'll be overwhelmed as nurses. I feel as though if we could really grasp how to navigate ourselves as students in this climate, you know, especially even going out and dealing with COVID patients, and you're feeling very overwhelmed because nurses don't want to come to work. So now you yourself acting as a nurse, you have to do the medication, you have to take over patients, you have to do the road reports and the rounds and etc. I feel as though that's the positive, you know, take away from that. That's what we learn. We learn that in crisis, we could operate in a crisis situation basically. And I know that other students globally could do that as well. So I think when I think of that, I say to myself that in terms of the nursing profession going forward, it's in good hands.
Okay, great. Thank you for that. All I'll say is I'll tell Betty Ann Pilgrim she has competition. She'll be the chief nurse in Trinidad. I'll tell
No, far from there.
You know, thank you. So listen, I'm gonna start rounding up. So thank you for that. I'm gonna go to Patrick. You're gonna have 2 minutes, and I'm gonna come to Flora May and then I'm going to come to you, Victor, and so you each get at least 2 minutes to say what you'd like as part of the format for the others who have been joining us. So Patrick, over.
Thank you very much. This has been an eye-opener and a good free space to speak and to learn from other people from other continents as well. The only thing, there's some things I just want to highlight is during this pandemic, we have been able to, student learning has been able to be fast-tracked so quickly that we learn so much, and we learn leadership. The leadership role is very, very, like, when I look at the improvisation that's been made in different hospitals around the world, and the role of the nurses, and especially more so the nursing managers. Like, I was in ED, the ED was turned upside down. There are so many parts of the ED that they say, oh, this was this before, boom, gone. This, and so, and you can see, and nurses carrying walking, talking, and some people can come into the COVID side, the clean side, and the only way they can talk is as if you are on the building side. You have to carry walking, talking, and okay, all the notes and everything has to be this, they can touch this. So that is one thing, and the teamwork has been said earlier. It was really, really great to see the teamwork. But another thing I just feel like, because I know Ireland cues from UK, is the review of student learning, like, oh, you are stage 2, you can't do this, you are stage 3, you can't do that. As Nicole said, that's about the red tape being lifted during the COVID. I don't know whether those red tape will be putting back on, because sometimes it's like I got frustrated at some stage, like I was able to do much in ED, in ICU, in this, in that. And I went to a place and they said, oh, you are stage 3, you can't do this. And I was like, come on, it's kind of, you've been relegated back, like, okay, this is how, the only thing you can do, this is this and that. And it's like somebody deflates your balloon, and it's really like, it's your morale just drops straight away and say, come on, I need to do this. I need to practice my skill to do more. And that is one. And the final thing, the final note I just want to say is about the environment that nurses are working in. I don't know, like NHS needs to look at this in America, in Trinidad and Tobago, everywhere is the nursing environment. When I said nursing environment is the quality of air, because the COVID makes us to understand that the quality of air that we breathe in really, really is very important. And when you see at most of the hospital, they are not measuring the CO2 level, they are not doing air sampling and all that, and there is no ventilation. And even where there is ventilation, the doors, the windows are being closed because patients who are not mobile, they are cold, or they are frail, elderly people because of that. And nurses have to work in this environment. And I don't know, maybe the risk assessment again needs to be done when it comes to those environments, because nurses are working in this environment. And more so for nurses that have long COVID, I don't know internationally what's to be done for those people, because it's hospital acquired. It's not something that they bring in. It's hospital acquired, and it's what do you call it? It's something that there is something that they have to live with for the rest of their life. And most of these people are anxious. They have mortgage, they have families, they have responsibility, and what to be done for them, and to encourage us and the nurses that are coming to say, we have your back. Thank you.
Great. You've given us a lot to talk about, including long COVID. So, and I'm going to stick to the 2-minute rule. Flora May, your last concluding thoughts on experiences?
Yes, I honestly believe there's a little bit of a light in the tunnel from COVID, because COVID has not only brought to light how important nurses are, but what the functions of the nurse does, like how important that is, the assessment, the diagnosis, the monitoring, the continuous involvement of nurses in healthcare throughout all the spectrum, schools, outpatient clinics, everything. I believe that really highlights how important everything became. It's like before the pandemic, it wasn't as, I couldn't see it as much, but now I have. And even in being in nursing school, it really does bring to light how important it is. And as well, nursing students, we've all kind of felt the burden of expectations of trying to reach these goals when we come back from the Zoom to in person. And that's where it kind of lies of all the anxiety. But I think when we overcome that, that's when we become true nurses, especially when we graduate. I think that's a lot more like, okay, belief throughout the whole entirety of this whole thing.
Great, thank you. Orla, I didn't want to exclude you because your camera is off. I wonder if you want to pop in and give us your little concluding thoughts from what you've shared and heard.
I think it's time for the curriculum of nursing worldwide to be harmonized, because one of those concerns I used to have is when I qualify, if I want to practice in US, I have to do enclave. So there's this wall of, okay, this is UK, this is Ireland, this is, I think it's time we begin to, this pandemic has shown us, you see, during this pandemic, you see where countries begin to import nurses, irrespective of which country they are coming from. I think it's time we begin to harmonize and respect. And I'll be in RCN Congress in 2 weeks' time. And I think this is one of those things we need to talk about. We need to come to a place where we can harmonize nurses around the world. COVID in US is not different from COVID in Nigeria. It's not different from COVID in Ghana. It's not different from COVID in the Caribbean. It's time we need to begin to sit down together and see how we can harmonize it. And also, it's time for us to begin to talk about nurses' pay. You know, I spend time with nurses and I ask them how much you get at the end of the month. And I look at it, they do more of the physical work than the medical doctors. They are different. We can't compare the two, but it seems as if they just struggle to live. And that is why most of them, I've seen nurses who have decided to pull out of this nursing and go to work in Tesco, because the risk in Tesco is less than working in the ward, and they get more there. So I think it's time we begin to talk about this so that we begin to encourage the upcoming nurses. As a matter of fact, you know we are having a shortage of nurses, and still we are trying to even encourage people to come into the profession in the United Kingdom. Another thing we need to talk about is we need to talk about international students.
And international students. I'm going to call time. I'm going to call the 2 minute time. Last person, Victor, you have your 2 minutes. You're muted, Victor. Sorry.
Yes. Lastly, I want to quickly thank everyone for their contributions this evening. And Nicole, I want to appreciate your time and your input. First and foremost, I will quickly go on that word you mentioned, the idea of preceptorship. You are in year 3. I think, as I said, I've gotten a lot of calls from that. I've waged in, encouraged my students in that area. Oh, you are year 3. You can't do this. You don't know what you can't do this. You can't. So many things. I think, thank God you are aware of that, and I think we can have a change of heart for that. And again, now we're talking about COVID. The aftermath of COVID is already manifesting. The aftermath, that is the bigger scale. It's like a phase. We having the phase 1 was the stage 1 was the attack of the pandemic. Now aftermath, we are going to be dealing with people with psychological issues, mental issues. That is already everywhere in the America. I have family in America. I have in Caribbean, friends all over in Nigeria. They say in Ghana, all over the world. This is another scale, another battle. I would say the challenge we will be faced as nurses in the near future, not just near future, in the nearest 2 or 3 months' time. This will be emanating from children. I've seen children at 16, under 14, having mental health issues, all because of COVID. I think we have a lot to do. After all this, we have done this. I did that teamwork, which we exhibited during the COVID.
That's your 2 minutes. Thank you, Victor. So very quickly, I'm going to say, Dr. Gilmore, thank you for joining us as well, and your students. Shabi, any closing remarks from you?
Well, you've been lucky. My hands-up function was not working.
1 minute, Shabi. You have 1 minute.
So 1 minute, I can't do. You're my mentor. I can't do 1 minute. So no, just thank you for sharing all of that, because some of them probably remind you a bit of anxiety and stress you experience in practice. So thank you for sharing all that. It was very, very interesting. And I think we need to highlight how resilient you are. Because that was very difficult. You're only one who've experienced that during study, and I'm very proud to see how you get the positivity of it. and all the skills you could have and learning you could have taken from it. This is amazing to see that, and it's across the world. This is just, I'm so proud of you. It's really, really good. And it's really nice to see that you take that positivity. Oh God, I can't speak faster than that.
Before I hand over to Nicole, it's
thank you very much.
But Nicole, before I hand over to you, I just want to say, because you always do such a lovely closing, just to say to students, next month, it's LGBTQ plus Pride Month. So we're focusing on looking at LGBT care and patients and that sort of stuff, and how we become diverse and do that work with this community. But Nicole, for now, I always like to end with you.
Yes, thank you. Thank you
And
very
I'm going
much.
to tell you 2 minutes as well. I'm going to tell you 2 minutes.
Yeah, I'll be short. I have a long list, but I'm going to just go to the last one. The last one is just continue to care and share, and this transcultural exchange of what nursing means in the modern age, post-pandemic or during the end of the pandemic, is something that you hold on to. The world is your oyster as nurses. Don't limit yourself. Doesn't matter what your background is. Doesn't matter what someone calls you, what you answer to. So I am proof that actually being authentic, being your real self, it means you don't have to put on an armor and pretend. So be your authentic self, continue to care and share, and go out and just aim for the very top, because your patients need kind, compassionate leaders. And I can see that in all of you. So I just want to thank you very much for your time.
Great, thank you very much. And we'll see you all next month. Even though you're from abroad, if you're going to get on the mailing list, and do feel to join us. And we look to collaborate with all the other people who are here. So Gabrielle will contact Oscar. Florme, hopefully we have some contact for you, and John. Well, we know you're always here with us. So thank you all, everybody, and have a good night. I want to end on time. 3 minutes late.
Bye,
Bye.
everyone.
Bye.
Bye, bye, guys.
Bye-bye.
Patrick, bye. Bye, Kampala. Bye, Nicole. Bye.
Bye.
Bye. Bye. Thank you. Oh, I need to press stop. Neil told me I have to press stop.